Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Over the last 24 hours, we identified 456 new cases of COVID-19 in the province. Our labs completed about 8,200 tests, and the positivity rate was about 5.6%. Our positivity rate is declining, but it is still far above the 1 to 3% that we saw for most of the summer and fall. The numbers fluctuate on a daily basis, but we continue to see an overall decline in our testing numbers from last month. We don't know all the reasons for this, but one factor could be fewer people getting sick. While having fewer people showing symptoms and needing testing is a good thing, I want to remind anyone who experiences any symptom of COVID-19 to stay home and book testing immediately. Tests are available within 24 hours all across the province. Turning to schools, there are currently active alerts in 147 schools and outbreaks in 2 schools, or about 6% of schools in the province altogether. There are 212 total cases linked to these schools. Our hospitalizations remain high, and the strain on our acute care system is still being felt, with 740 people in hospital, including 119 who have been admitted to the ICU. Sadly, 17 new deaths have been reported to us in the last 24 hours. My deepest sympathies are with the family and friends of these individuals. These were parents, grandparents, siblings, co-workers, neighbors, and friends to many, and their loss is felt by communities across Alberta. Turning to vaccine, I know that there are still some questions about those seniors who have and haven't been offered vaccine. As I noted yesterday, staff and residents in all long-term care and designated supportive living facilities have received the first dose, except for those who declined or could not receive it due to illness, absence, or a medical contraindication. Residents in facilities that are mixed are also receiving the vaccine if there is an opportunity for residents who are part of a long-term care or designated supportive living site to interact and mingle on a daily basis with those in beds of different care needs. Many of these residents in mixed sites receive the vaccine at the same time as those in the long-term care and designated supportive living. But Alberta Health Services may need to immunize some separately due to the vaccine shortage. I know there are families with residents in other types of facilities wondering when their loved ones will have access to the vaccine. We started with long-term care and designated supportive living facilities because residents in these locations are the most at risk. 2 out of every 3 Albertans who have died from COVID-19 live in these settings. We will be administering vaccine to all other settings where Albertans age 75 or older live as a part of our next phase. We want to begin this as soon as possible. Unfortunately, the exact timing depends on when the vaccine arrives. Finally, since the updated measures were announced on Thursday, we've received many questions about when other restrictions will be eased and when people can expect to resume other activities that they love. It's natural to want to get back to all the things that we've missed during the last 6 weeks. However, our health system is still under severe strain, with 740 people still in hospital. This continues to impact our ability to deliver care not only for COVID-19, but all the other health needs that Albertans have. I know this is challenging, but we all must continue supporting each other by doing everything possible to reduce the spread of COVID and to protect our health system for a little while longer. The more successful we can be at this reduction, the sooner we are in a position where we can consider safely and slowly relaxing other measures in the days and weeks ahead. Thank you, and I'm happy to answer questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. I've been speaking with a doctor who received his first dose of vaccine but has not been able to book his second dose appointment. He was told by someone at HealthLink that they are not allowing people to schedule second dose appointments. An ICU nurse tells us she showed up for her second dose appointment but was told it was a booking error, wasn't vaccinated, and was told she could not rebook. So to be clear, these appointments are not being delayed or pushed back. They're not being booked at all. I've reached out to AHS, but I'm looking to get some clarity on what's happening with these second dose appointments. Both the Premier and yourself said yesterday that those appointments would go ahead, that there would be enough vaccine for them. So is there vaccine available? How come second dose appointments are not being booked? And how come there are issues surrounding this process?
Thank you for the question. We know that when we got vaccine early in December, which was earlier than we had originally been told to expect it, some of the booking tools that were being built were not quite ready. And so some of the booking that was happening in December was being done through the systems that were already running. And since the beginning of January, we have shifted into a single online booking tool that Alberta Health Services is running. The specifics of the cases that you've mentioned, I can't comment on. I don't know the details about individual cases, but I can say that currently the work that's being done by Alberta Health Services is to prioritize all second doses. As you likely know, the federal government today did announce that there will be some further reductions of Pfizer vaccine, and so there may need to be some shifting of some second dose appointments, and Alberta Health Services is working as hard as possible to make sure that people know what to expect and when they can and how they can book their second doses. So I ask for people to be patient, and with respect to those two specific cases, ideally that those individuals would follow up with the people, the managers that they report to, or the people in AHS with whom they work to find out what next steps they can take.
Operator, can you put through the next question, please?
Brenna Rose, CTV News.
Hi, Dr. Hinshaw. Thanks for taking my question. I was just wondering if you could provide an update as to where our province is in terms of the vaccine. Has our supply completely run out?
We do have some Moderna doses that are being used to offer second doses. With respect to Pfizer, I don't have the current numbers in front of me. We did get some Pfizer vaccine this week, but I'd have to follow up offline to be able to let you know exactly how much we have.
Operator, could you put through the next caller, please?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. Again, it's just to clarify on Pfizer's announcement today that there will be no vaccine this week. Can you explain a little bit of how that will affect the rollout in the next couple of weeks? Will it cause further delays and cancellations into what's already been announced?
As you likely can understand, we just received that news this morning, and so we're working very hard to adjust all of our planning, our spreadsheets, and our forward appointment bookings. So Alberta Health Services is doing that work today. I don't have then a specific ability to say exactly how that will roll out, especially because we don't yet know exactly how much Pfizer vaccine we'll receive the first 2 weeks of February. What I can say is that second dose vaccine for those who live in long-term care or designated supportive living are our top priority, and getting second doses for those very high-risk individuals will be prioritized. We will also be doing everything we can to provide second doses to all others who've received their first vaccine within the approved window of time. Some of those second dose appointments may need to be moved, but we don't yet have that determination. It will depend again on the work that's being done today and over the next several days once we get further determination of our February numbers.
Operator, can you put through the next question, please?
Lisa McGregor, Global Edmonton.
Thanks for taking my question, Dr. Hinshaw. Do you think the current classification of what makes a seniors facility, LTC, and DSL adequately reflects all of the vulnerable Alberta seniors in need of a vaccine right now? And what is your reason as to why vulnerable seniors getting long-term care or similar in, say, lodges or licensed facilities that have still faced COVID deaths and outbreaks are not getting the vaccine yet? Does it come down to simply they might not be places that are designated with long-term care beds funded by AHS or a certain contract with AHS?
When we were looking at the sequencing of offering vaccine to different groups. We looked at the numbers and the outcomes that we've had. As I mentioned earlier, 2/3 of all of our deaths have been in long-term care and designated supportive living facilities, or in residents who live in that particular designated bed. So what we can see from our numbers is that these are absolutely the highest risk locations, and that people who live in these facilities are the most vulnerable to severe outcomes. And that's why those particular groups were first in the sequence, because they, by the very outcomes that we've seen in Alberta, do have that very high risk. When we look at other seniors facility and other types of accommodations, what we've seen is that there is a risk of age itself. So the older an Albertan is, the higher risk they have of severe outcomes. And that's why in our next phase, as soon as we have vaccine, we will be able to offer that to seniors who are 75 and up, no matter where they live, so that seniors who live in lodges or who live in other types of accommodation will be able to access that vaccine, because you're quite right, there are many Albertans who can benefit from the vaccine, and we want to make sure that we're making it available to them as soon as possible, as soon as we have sufficient supply.
Operator, can you put through the next caller, please?
Lauren Flynn, Global Calgary. Line is open.
Hi, Dr. Hinshaw. Thanks for taking my question this afternoon. Just hoping for a new variant update. Can you let me know how many of each new variant cases we have here in Alberta, if there has been any community spread, and your reaction to the numbers that you will be giving me in the next few minutes, and how things are going with that here in Alberta?
As of this weekend, we had identified 12 cases of the variant that was originally identified in the UK, and 2 of the variant that was originally identified in South Africa. There continues to be no evidence of community spread. All of these were in people who were returning from travel. I would want to make sure that Albertans remember that if they are traveling, and I would recommend against non-essential travel at this time, if they are traveling, it is critical that they follow precautions when they're away, and that they be prepared to follow quarantine or isolation when they come back. As even in the border pilot, we are detecting, and we are able to detect many more on that first test than we otherwise would be able to. So Albertans need to remember to follow safety precautions no matter where they are, and to make sure that they are not putting themselves and others at risk when they come back.
Operator, can you put through the next caller, please?
Brian Meller, Yahoo News.
Hi, Dr. Hinshaw. Thanks for taking the time today. It's almost been a year since Canada's first COVID-19 case, which has put a political spotlight on provincial health officers like yourself. How would you describe your approach in trying to build a high level of trust with the public amid so much controversy relating to matters like travel restrictions and COVID-19 vaccines? And how does your relationship with Premier Kenney play into that?
I would say that my approach is the same as it has always been pre-COVID, as well as since the response to COVID began, which is that I, since taking this role on, have made it a commitment to provide accurate information to Albertans, accurate information on risks and the rationale for recommendations. And I think that ultimately Albertans can decide on how they respond, but that's my commitment, and that's what I've always striven. I've always done my best to do.
All right, I see just one more in the queue. So operator, could you put through our final question, please?
Our final question comes from Darcy Rutherford of City News. Your line is open.
Thank you. Dr. Hinshaw, we've heard reports that there's a COVID outbreak at the Suncor plant in Fort McMurray. I'm just wondering if you can, A, confirm that, and B, just provide some details around the numbers there. Thank you.
I would have to get back to you on details. Of course, in various settings, we do have outbreaks that come and go. I can tell you that I don't have the specifics of a particular Suncor outbreak right now, but I know that whenever we've had cases and a limited amount of spread in any of the facilities or with any of the companies that work up north, that we've always been able to work very productively with them. And we'll follow up and get you the information offline.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.